the China healthcare market, it is about $50 billion in pharmaceutical market today, about $20 billion in med tech. It's a fraction of the developed markets, but it's actually growing at about 20% a year. And in 4 or 5 years' time, that will become the number 2 or number 3 healthcare market in the world in just pharmaceuticals and med tech. But within that $50 and $20 billion, it's actually a huge difference between the tier 1 cities and then the rural areas. And even within the tier 1 cities, there are actually some very advanced, sophisticated hospitals. And within the same city, you can actually see some very primitive, not up to speed clinics. So as a result, it's actually a market with very diverse hospital clinics, patient population. And for healthcare companies to address these opportunities, they actually must move away from the one-size-fits-all model from in the developed markets, which is a relatively high-end, more premium product or service offerings, but really take some of that core capabilities and technologies and really customize some of that solutions for China. China is actually not one market. There's actually several regional markets. So having different regional commercial models, i.e. how do you do distribution, how do you service your customers, how do you educate your patient, how do you educate your physicians, need to be actually different. We think there are really several key elements to win in emerging markets. First, you really need to have the right product portfolio. We talk a lot with our clients about good enough products. Emerging markets, the high-end premium segment is pretty small. The mid-tier or the mid-end market is really where the bulk of the volume is, and very oftentimes is actually increasing its share of the overall profit pool. So if you really want to win in emerging markets, you need to win in the mid-market, a good enough market. Great example is in the DES and the stents space. In China, for example, 5-6 years ago, the 3 multinational companies control about 95% of the market in terms of volume. So the Chinese local players are about 5% of market 5-6 years ago. Today, it's actually the reverse. The Chinese companies controlled about 70+% of the market. The multinationals only have about 20-25% of the market. Distribution in emerging markets, whether it's India, China, or other developing markets, is really important because is a diverse geographies, big land mass, a lot of population, which are quite dispersed. So stay away from the one-size-fits-all go-to-market model. You probably need to come up with 4 or 5 distribution models. Third key element is really about finding a potential partners or doing M&As to help accelerate your growth in emerging markets. Being a key stakeholders in the whole healthcare system, whether it's in China or India. We call it the stakeholder or PR strategy, i.e. you need to really build a brand, build relationship with key stakeholders, whether it's with the government, whether it's with the scientific opinion leaders. So your brand, your products, and your organizations are being put into the forefront of the healthcare business in China. Final point is about organization commitment. A lot of the multinationals or companies in general, just we work with, really have a rather complicated, complex organizational reporting, country back to region, another region back to headquarters. It's a matrix that quite often will hinder the speed and then pace of the local team executing. We found the winners are typically the ones who actually enable and trust a local team within certain boundaries to execute on their local strategy. The speed of execution, the speed of decision-making and execution in market is critical to win in emerging markets.